National Patient Safety Goals for 2007, the Joint Commission emphasized the need to reduce the risk of patient injuries from falls. This is a very nursing-sensitive quality indicator in the delivery of inpatient services. Nurses assume the primary responsibility and are somewhat liable when a patient falls in the inpatient care unit. As of October 2008, Medicare is no longer reimbursing healthcare facilities for reasonably preventable medical errors. The following are some of the strategies and interventions that nurses, non-licensed assistive personnel, and family members can implement to prevent patient falls while in the hospital. Leaving the bed in the highest position represents a risk for falls. When you are ready to leave the room, make sure that the patient's bed is in that lowest position. Beds with the wheels not locked are a permanent risk for falls. Keep the brakes on at all times. All the rails up are considered restraining the patient in bed. Leaving the rails down puts the patient on risk for falls when they turn while sleeping. When the patient is able to get out of bed by him or herself, you must leave at least one of the rails down and the bed in its lowest position so that the patient can get out of the bed without risk of falls. Throw rugs, litter, and cords continuously expose the patient to risk for tripping and falling, especially at night when there's not enough illumination.
Good morning, Mr. Gonzalez.
Good morning.
Okay, we're going to X-ray to have an accident today, okay?
Okay.
You will go with me. Okay, let's go. Let's go. Whoa! Whoa!
Serious injuries could be the result from falls caused by rollaway wheelchairs. Patients that fall have a high risk for fractures of the hips, arms, ribs, or skull. Before transferring a patient to a stretcher or wheelchair, make sure that you have the wheels locked and the footrests are cleared and out of the way to prevent falls. Preventing falls saves lives and tens of millions of dollars in insurance costs.
Good morning, Mr. Gonzalez.
Good morning.
Okay, I'm Francis. I'm a nursing assistant today. You know you're supposed to have an X-ray today.
Yes, sir.
I'm going to transfer you from the bed to the wheelchair just to have an X-ray. That's good for you, okay?
Okay.
Stop. Did you check to make sure that the brakes are on?
Okay, before, let me put the bed in the lowest position, please. Okay. Okay.
When transferring a patient from the bed to a wheelchair, use the gait belt and assist the patient in standing and pivoting and for seating them into the wheelchair
You
to
okay?
prevent falls.
Just you take the chair now. Sit down. Thank you, Mr. Gonzalez. We're going to have your X-ray, okay?
To prevent orthostatic hypotension and secondary falls, give enough time to the patient to sit on the side of the bed dangling their legs for at least a minute, making sure that they're not feeling dizzy. If necessary, make sure they use a cane or walker before getting up, and keep the call light handy. Finally, do not forget to put an orange or yellow bracelet on your patient's arm. That will indicate to the staff that your patient is at risk of falls.